morning. I am Dr Rajani Uday. I am a senior gynecology professor from Ramaiah Medical College, Bangalore. So today we have a hot discussion all around, including the doctors, public, politicians, all over are confused with the state of corona status, that is COVID-19. So today, as a gynecologist and obstetrician perspective, I would like to give some information regarding the COVID-19 in pregnancy. As we all know, COVID-19, which has originated in Wuhan and China, has become a global threat. Pregnancy, they are more vulnerable because they are in a state of immunosuppression and also the physiological adaptive changes. Incubation period of COVID-19 is 2 to 14 days, but still the pregnant women can become vulnerable to these viral infections before they become symptomatic with the close contact. So COVID-19, how does it manifest in pregnancy? As we see in the non-pregnant and adult status, pregnant women are also being affected with the fever, myalgia, throat pain, dry cough, dyspnea, and even hemoptysis. Sometimes even just like a common cold, running nose, nasal congestion, landing up with the hemoptysis and even diarrhea manifestation. So what are the tests are required for diagnosing this COVID-19 infection? As we do the routine blood test, which shows WBC count, which is raised, and especially in the early stages, leukocyte count is reduced, lymphocyte count is reduced, C-reactive protein kinase is also increased, liver enzymes have been affected. These are the screening tests to not to confirm the diagnosis but to suspect the COVID-19. Important test, there's RT-PCR, that's a gold standard test for diagnosing the COVID-19 infection. Another important complication with the COVID-19, as I said, it can manifest with the upper respiratory tract, but it can spread to the lower respiratory tract, causing the pneumonia. So we may need to do CT chest to confirm the diagnosis of a COVID-19 infection, as it has a more sensitivity showing 98% as compared to that of a 71%. We may need to do the other cultures, blood culture, to rule out the other associated infections, which are bacterial infections, which can be there along with the COVID-19. Apart from this routine tests, you need to take the specimens from the upper respiratory tract, nasal and throat, sometimes even the lower respiratory tract through the endotracheal collection. Through those cultures also are required to confirm the diagnosis, taken 24 hours apart to say that this is definitely due to the COVID-19 infection. Then coming to the complications, what are the complications of COVID-19 infection? COVID-19 infection can affect pregnant women, as I said, from the early trimester to that of a last trimester. The early trimester, what they can manifest with the abortions, first trimester abortions. In the second and third trimester, they can have premature labor, premature rupture of membranes, fetal distress, fetal tachycardia are noted, especially when COVID-19 is affecting the third trimester of pregnancy. So knowing the complications affecting the mother, and if the fetus also is being affected, definitely the fetus can have severe pneumonia and which can succumb to death. So we need to protect both mother and the fetus. Let's see the preventive aspect of COVID-19 in pregnancy. Apart from the social hygiene, what we are doing regularly, that it applies very well to the pregnant women. The other thing is that where she should avoid a sick patient, she should avoid crowd, she should avoid traveling. So she should not be in the any group. So these are the precautionary measures where she need to take to prevent the COVID-19 infection. In case if she is affected with the COVID-19 infection, she requires a tertiary care center where it has a multidisciplinary facilities which are available to manage her. So the management of this COVID-19 pregnant women, where we need to triage them. So as I said, it is a multidisciplinary, where in the mild cases we can manage, whereas a severe and critical cases where they may require ventilation, mechanical ventilation, or if it is a severe respiratory resistant hypoxia, they may require extracorporeal membrane ventilation. So let's see the patients to triage the pregnant women with the COVID-19. You can classify them for the management purpose. Mild cases where they are having a vitals which are stable. Severe cases where the respiratory rate is more than 30 and oxygen saturation less and oxygen concentration. So these are all the patients where severe requiring the mechanical ventilation. The other group is a critical group where they have an affecting the major vital organs, kidney, heart, lungs, so they require the ICU care. Management of a COVID-19 pregnant patients requires a multidisciplinary approach, requiring the obstetrician, senior midwife, pediatrician, anesthetist, microbiologist, and the facilities should be available for the management to manage the mild to severe cases of COVID-19 pregnant patients. The first thing, if it is a supportive care is required, where they require adequate hydration, water and electrolyte balance which has to be managed. This is a regular supportive treatment for a COVID-19 pregnant patient for a mild cases. Severe cases as they require the ICU care. No doubt the drugs, no vaccine is yet available. The drugs which have been tried in pregnant have shown results which are not they are good enough to treat a pregnant patients. Lopinavir and ritonavir, 2 capsules a day, apart from interferon inhalation in saline, has shown good results in a pregnant patients. Coming to the obstetric management. Obstetric management requires, as I classified, mild patients, they can continue to term. So you can continue to term means it is understood they can go to the expected date of delivery or 38 weeks to 40 weeks of pregnancy. No doubt they require intensive monitoring where they should be aware of a fetal movement, fetal count chart, regular ultrasound, seeing for the biophysical profile, if required even Doppler studies to see the affection to the baby. In associated complications, apart from COVID-19, there may be other associated obstetric conditions like preeclampsia, heart disease, RH incompatibility. If there are some diabetes, gestational diabetes, then it is an additional risk factor added to this COVID-19 in pregnancy. So the management depends upon the severity of the condition and we need to manage. Next comes the critically ill COVID-19 patients. COVID-19 patients with the critically ill in early trimester and even late trimester. Definitely, mother should be protected irrespective of the fetus in early pregnancy. So we may have to save the mother irrespective of the fetal outcome, where we need to counsel the patient relatives regarding the termination of pregnancy early to save the mother. Regarding the mode of delivery. Mode of delivery, studies have proved like they have not seen COVID-19 virus in the amniotic fluid or the breast milk or the vaginal secretions. So vaginal delivery is not contraindicated in COVID-19 pregnant affected patients. Vaginal delivery can be allowed. You can continue pregnancy and allow for spontaneous vaginal delivery and deliver the baby. While delivering the baby, we may have to early clamping has to be done, and baby has to be separated from the mother for isolation, has to be kept in isolation ward. As why we need to do this? Because you are separating the baby from the mother, so the contact is avoided, infection is prevented. Baby should not be breastfed. If needed, the mother can express the breast milk by the nurse can feed the baby, as breast milk does not contain the virus. Regarding the cesarean with the COVID-19 patients, all specialties including the anesthetists, everybody, as we need to protect ourselves, technical, nursing, all people in the OT, we need to protect ourselves with the all the equipment what is provided to shield ourselves from the coronavirus while doing a cesarean. Cesarean is not a contraindication, vaginal delivery also, but cesarean is indicated associated complications as I enumerated: preeclampsia, diabetes mellitus, elderly primary. If needed, cesarean can be done. Vaginal delivery also is possible. So, with all this, I say that as we have to live with corona, as we have to live with the COVID-19, and it is continue to spread, so we should be proactive to manage this condition, and with all the multidisciplinary approach where to at least to prevent the spread and to manage these pregnant women with a good maternal and fetal outcome. Thank you.